Hi, Mary. My name is Sandy. I work here with your healthcare team, and I understand that you came in to see Dr. Wilson today for your annual screening, and he had asked me to come in and talk to you a little bit about the alcohol assessment that you had filled out. Would you be okay talking to me about that?
Yeah, I guess.
Great. Thanks. Can you tell me on a typical week how much alcohol you're consuming?
In a typical week?
Yeah.
Usually I go home after work and I have a couple beers. Well, actually, we get off work at about 5, and I usually go to the little store and I pick up a 6-pack, bring it back. We all have a beer or so, and then I go home and I have a couple beers.
So after work, you usually go out and socialize with your friends. You have a beer or two, and then sometimes you'll come home and have an additional beer or two.
Yeah, I try to keep it to less than 4. Because if I go over 4, I usually feel really crappy the next day and I just can't function very well. And if I go over 4, I go over 5.
Okay. What happens if you go over 5?
Well, sometimes nothing, but sometimes I do really embarrassing things and I feel really guilty the next day and I have a terrible hangover. I just can't function. So there are times when I can keep it to 1 or 2, I can do that. But then, people are partying, they're having fun, and I just say, oh, forget it. But then, things get out of hand.
And that's what you're concerned about, is when you go too far.
Yeah, I'm very concerned about that. But it's not like I'm an alcoholic or something. I wake up, I'm not shaking, I don't have to have a drink. First thing in the morning, I think I'm never going to have another drink again.
So you have a really strong resolve not to drink again after a night like that.
Yeah, definitely. But I'm not an alcoholic. I just want to figure it out. If I was an alcoholic, I would just be drunk all the time and not care. I just want to learn how to drink like other people drink.
You don't identify yourself as an alcoholic, and you don't have to have a drink. But what I'm also hearing you say is that you would like to really reduce the amount of alcohol that you do drink.
Yes, that covers it.
Okay. So would it be okay if we went over your form together?
Sure.
Great. So as you can see, your results have placed you at the top of the pyramid. This category of people sometimes experience consequences related to their alcohol intake. And this could be drinking too much, not remembering what happened the next day, often feeling like alcohol is interfering with their lives. The other thing we know about people who fall into this category is that they might need some additional help to stop drinking.
Do you think I need to stop drinking?
Well, the medical recommendation for someone scoring at your level is to completely stop drinking, but that's ultimately up to you. What I would recommend is for you to see a specialist, sit down with them, and figure out what makes most sense to you.
I think I just want to figure out how to drink. I'm not sure I want to quit, but I would sit down with somebody and try to figure it out. I don't think I can even imagine my life without drinking.
So you're not sure you want to completely quit drinking, but you know you don't want to continue down the same path. It sounds to me that you're willing to talk to someone right now.
Yeah, I think that would be okay. Do you know someone?
Yes, actually, our clinic works closely with an organization called Northwest Treatment Services, and I can make a phone call with you to one of the counselors. They set up an initial appointment where they get to know you and your alcohol use and figure out what works best for you.
So they won't force me into treatment or anything?
No, you're in the driver's seat. They'll perform an assessment of your drinking, and based on that assessment, they'll make recommendations. And it's really up to you to decide what's going to work best for you.
Well, that might be okay then, as long as they don't, tell me what to do.
So it sounds like you're open to seeing somebody, but you're not open to someone telling you what to do.
Yeah.
So if you were to rate your readiness to set up an appointment on a scale from, let's say, 0 to 10, 0 being not ready, 10 being ready, where would you rate yourself on that scale?
Probably a 6 or 7.
Okay, 6 or a 7. Why not a lower number, like 3 or 4?
Why not 3 or 4?
Uh-huh.
Well, probably because at a recent work function, I got really drunk, and I feel really embarrassed about some of the things I said and did. And I just want to stop feeling that way.
Any other reasons?
Well, I don't want to do things I regret. I need to change things.
So you're really ready for a change, and you recognize that drinking is becoming a problem in your life. And even though you're not ready to completely quit drinking, you realize that you might need some help figuring out some next steps. So given that, what do you think you're going to do?
I think I'm ready to go see someone.
What do you think about taking a few minutes to make a phone call today, set up an appointment?
Right now?
Yeah, I know Susan. She's an intake counselor. we can call her, set up an appointment, and you can have one before you leave the office today.
Well, that makes me a little nervous, but that's fine.
Great. I want to thank you for your openness and honesty about your alcohol use and sharing that with me today. If it's okay with you, I'd love to set up an appointment in 4 weeks just to check in, follow up about how things are going.
Sure. That's fine.
Great.